Saudi Arabia's King Salman received telephone calls from several leaders and officials on Friday wishing him Eid Al-Adha greetings and health after his recovery from an operation. Sheikh Mohammed bin Zayed Al Nahyan, Crown Prince of Abu Dhabi, congratulated King Salman on the blessed occasion and on his discharge from hospital. Bahrain's King Hamad bin Isa Al Khalifa also wished the king Eid Mubarak and expressed happiness over his speedy recovery from an operation on his gallbladder. The king also received similar messages from Egyptian President Abdel Fattah el-Sisi, the Sultan of Oman Haytham bin Tariq, Palestinian President Mahmoud Abbas, as well as leaders from Djibouti and Indonesia. For his part, the king also passed on Eid greetings to the leaders and thanked them for their kind messages on his health. There were 1,686 new cases of the novel coronavirus, COVID-19, recorded in Saudi Arabia on Friday, but none were detected among the Hajj pilgrims. The new cases announced by the Ministry of Health brought the total number of confirmed cases in the kingdom to 275,905. Of the new cases, the highest number was reported in Mecca with 178 infections, but Hajj pilgrims remained virus-free as of Friday. The rest of the new infections were confirmed in cities and provinces across Saudi Arabia. Saudi Arabia implemented a number of measures in order to keep pilgrims safe from infection during a restricted Hajj pilgrimage this year. In the past 24 hours, 24 more people died due to COVID-19, which raised the virus-related death in Saudi Arabia toll to 2,866. The total number of recoveries rose to 235,658 after 4,460 more people recovered from the virus. There have been no health problems so far among pilgrims during Hajj, Ministry of Health spokesman Mohammed Al-Abidi Al-Ali said on Thursday. It is reassuring that no cases of coronavirus or any other diseases that affect public health have been reported, he said during his daily Hajj briefing in Mecca. He added that the health services are fully prepared and remain on high alert to respond to any problems that arise. There are 1,456 hospital beds available, including 272 for intensive care, 331 for isolation, and more than 200 in emergency departments. Field teams of healthcare workers were on hand on Thursday, said Al-Ali, as pilgrims climbed Mount Arafat and then moved on to Muzdalifah. In addition to providing any treatment that was required, they also offered support for the preventive measures and precautions that have been implemented to prevent the spread of the coronavirus. Lieutenant Colonel Talal Al-Shalhoub, security spokesman for the Ministry of Interior, said that the pilgrims were escorted safely to Mount Arafat to perform their rituals, and then to Muzdalifah. He added that security officers are supervising pilgrims to ensure that social distancing and other precautionary health measures are followed. In addition, he said, they have prevented a number of unauthorized individuals from gaining access to the holy sites. Technology is being harnessed again this year to provide better services for pilgrims, according to Dr. Abdul Fattah bin Sulaiman Mashat, Saudi Arabia's Deputy Minister of Hajj and Umrah. Mashat said that for the second year in a row, the ministry had implemented the Smart Card initiative, which aimed to provide high-quality services to pilgrims and facilitate the journey of worshippers while performing their rituals. The Smart Card was an extension of the Smart Hajj platform, which covers the digital identity of the pilgrim. Mashat said that, with this year's requirements, services related to the card had been developed to include the personal, medical, and residential information of the pilgrim, including his Hajj regiment, bus and seat number, residence, room number and bed. In addition, it helped to guide pilgrims to their homes and controlled their entry to site facilities, in addition to reducing irregular pilgrims. Mashat said that one of the most important features of the Smart Card was its design using a set of color groups related to program services, grouping and transfer, and included NFC technology to read Hajj data through self-service devices. In addition, it contained a barcode that Hajj workers were able to read to improve services provided to pilgrims. He said that the ministry had started the implementation of the strategic executive plan for this year's Hajj season early following the kingdom's decision to organize Hajj for very limited numbers. This was to prevent the spread of the coronavirus, as it would have been impossible to ensure social distancing had a large number of pilgrims been received. Mashat said, the ministry, and all parties concerned with organizing this year's Hajj season were keen on procuring the best services to pilgrims while applying the highest health and safety standards, and the preventive and precautionary measures, according to the directions of the kingdom's leadership to provide the best services to the pilgrims. Though the coronavirus pandemic has affected many things, the culture of volunteering continues to remain strong in Saudi Arabia, as citizens serve the kingdom's visitors from all over the world. Mashal al-Mubarak, the General Director of Volunteering at the Ministry of Human Resources and Social Development, told Arab News the kingdom had paid special attention to the issue of volunteerism, as well as its organization and stimulation, despite the crisis. Voluntary work carries new horizons, hopes and aspirations in light of the pandemic. Doing voluntary work symbolizes solidarity and cooperation between members of society, she said. Voluntary work's importance stems from its active role in developing societies by strengthening the belonging of citizens, investing human energies and directing them towards serving the society by relying on the principle of cooperation, partnership, and creativity. The goal of volunteering is to grasp positive effects that contribute efficiently to collective efforts, in order to serve the issues that affect the different segments of Saudi society, she added. The Saudi government made volunteering an important axis in the kingdom's Vision 2030 plan, and it was included in 3 important programs: the National Transformation Program 2020, the National Character Enrichment Vision Realization Program, and the Doya al-Rahman program. Volunteers played a very important role in contributing to facing the COVID-19 pandemic that invaded the whole world and reducing its negative effects with several services, the most important of which was the volunteer work platform, al-Mubarak said. This platform is designed to be a pioneer in volunteer work to face the pandemic's repercussions. It is characterized as a Saudi incubator for volunteer work that provides a safe environment, which serves and organizes the association between agencies providing volunteering opportunities and volunteers in the kingdom. The number of registered beneficiaries on the platform has exceeded 228,000 with more than 2,600 organizations. Al-Mubarak noted that the ministry had also launched a volunteering manual in crises and disasters using COVID-19 as a model, and a practical guide to help entities and individuals direct volunteering efforts to overcome the resulting repercussions. This guide focuses on the pandemic in the kingdom and how to reach the official authorities with whom they can volunteer during this period, said Al-Mubarak. She added that the ministry would take practical steps to promote volunteer work during crises and disasters, managing risks and identifying priority interventions for each target segment, and presenting a set of national initiatives, international experiences, and pioneering initiatives in various countries of the world during crises and disasters to benefit from them. The General Administration of Voluntary Work of the Ministry of Human Resources and Social Development have confidence in their ability to reach 1 million volunteers annually by 2030, to contribute to the advancement and reconstruction of the country. In 2020, in light of the COVID-19 pandemic, the number of volunteers reached 61,753, implementing 2,279,182 volunteer hours through 22,665 opportunities, said Al-Mubarak. For his part, the volunteer community's CEO, Rei Salman, told Arab News, volunteering is the only work that reflects the giving nature of people, as it is carried out with the selfless desire of volunteers to serve their community. In Saudi Arabia, volunteer work has become a subject of the leadership's interest and trust in the last 10 years. Our leadership has faith in volunteers, of both genders, as some government sectors have launched a series of initiatives that have contributed to empowering and involving volunteers, especially in the field of serving the pilgrims, which every Saudi and expat on this earth considers as a great honor. Al-Maliki said that every year, before the Hajj season, a flow of volunteers who wish to help during the season come forward. However, 2020 may be different due to COVID-19, and would require new and different initiatives, such as sterilization initiatives, social distancing measures and education for pilgrims about safety. I believe that a platform that brings together all initiatives related to the service of the Grand Mosque and the Prophet's Mosque's visitors should be launched, in order to organize volunteer efforts in the Hajj and Umrah season. It will be supervised by a program serving God's guests, which was inaugurated by King Salman in 2019 and is one of the Saudi Vision 2020 programs, said Al-Maliki. This program analyzes and identifies the need for volunteers, by engaging them in voluntary opportunities belonging to non-profit organizations in order to provide an opportunity to participate in serving the pilgrims and achieving the development goals of the program. It is through this organization that volunteers can carry out their work easily and effortlessly, without the trouble of searching for their voluntary needs, he said. They will not be exposed to exploitation or loss of rights, as this platform will be the link and guarantor for all parties and the coordinator of their relationship. We in the volunteer community have contributed over the past 2 years to empowering more than 3,500 volunteers through the Tamkeen projects aimed at qualifying volunteer leaders. We also launched the Volunteer Counseling Service, which provided 1,200 voluntary counseling sessions in 1 year, said Al-Maliki. Meanwhile, Dr. Ghada Al-Ghanem, a member of the Board of Trustees of the King Abdulaziz Center for National Dialogue, said, Saudis are passionate about volunteer work and have extensive experience and expertise, whether within the kingdom or abroad. Al-Ghanem added that the most important thing that governs volunteerism is the presence of an official body that shields this work, organizes it and ensures its reliability, to reassure parents that their children are under a governmental administration that is properly enhancing and qualifying their capabilities, and immunize them against extremism, and some agendas that function outside of the volunteering framework. She said that volunteers have become more aware of their responsibilities, the parties they join, their rights, and what they are supposed to offer. The relationship between volunteers and the organizations they work with is more like a contract characterized by commitment, transparency, and professionalism, in addition to having great benefits on self-control and preparation. On her personal experience, Al-Ghanem said that she spent 9 years volunteering inside Saudi Arabia and abroad, which prepared her for the labor market, adding that it was a rehabilitative culture, filling free time and meeting needs. The pilgrimage this year would not neglect the importance of organizing volunteerism, despite the small numbers of pilgrims, she added. Volunteers are expected to be trained on how to act, on precautionary measures, and on requirements, in addition to acting cautiously and responsibly.